Hi, thanks so much for tuning in to Mom Boss Chronicles. My name is Jen.
This is Sue.
And this is Danielle.
We are three moms that work together in real estate and are good friends, and here to talk to you about fun topics, the good, the bad, the ugly of mom struggles, real estate, and other fun stuff. So make sure to subscribe to listen to more.
Welcome back to Mom Boss Chronicles. We are joined today by a special guest, Aisling Lineham.
Thank you.
She is the owner of Paragon Pelvic Health with your husband, right?
Yeah.
Okay, so she focuses on pelvic floor health. I saw diastasis. I mean, there's so much actually that goes along with it. I think that we think it's just one thing, but it's really a myriad of things that are happening after birth or due to separation. First, how did you get into this line of profession?
Yeah, great question. So I've been a pelvic floor therapist for 14 years, actually.
Wow.
Yeah. And at the beginning, they were far and few between. You really couldn't find many people that treated pelvic floor. And when I went to grad school for physical therapy, I was a competitive figure skater. So my intention was to do sports medicine and athletics. And then we had a chance to elect a clinical, and one popped up that said pelvic floor therapy, and nobody in the class wanted it. And I just kind of got curious, was it because it was challenging or because it was something different? So I looked into it and I thought, I think I can handle the challenge and kind of go and try it out. And from the second I started, I loved it. You spend a lot of one-on-one time with women that were very vulnerable and had a lot of different things going on, and I felt as though you're making a big difference in their life with things that really matter, like painful intercourse, constipation, leaking when they're coughing, sneezing. Like, these are big quality of life things.
Oh my God, I have all these symptoms.
So many people do. You're not alone. And I just felt that there was a lot of value added. And so I still feel every year I'm learning and getting better at what I do, and that just makes it that much more enjoyable.
It seems like an area that, is expanding, and I'm seeing more pelvic floor professionals. I never heard of that at all. I mean, I only had my son at 5, he's 5.5, right? So that's not that long ago, and I never heard of that before. And I really wish that, kind of jumping off of our previous, and what we did, our previous podcast, and that, I wish that my OB was like, hey, here's a list of pelvic floor professionals that you can go to after.
And
I
you
had
should,
diastasis. I had no idea what that was. No one ever talked to me about it. I still just looked pregnant. And when I went for a follow-up visit, the doctor's like, well, you'll feel better when you lose weight. Yeah.
That's not it.
Right. And I felt like such shit after that, and then finally I started doing my own research, and I'm like, oh, I think I have this. I went to a physical therapist, not a pelvic floor specialist, because I did not know that existed. She helped me out, but, I just appreciate that you took the chance on this, and you're going to help so many other people. Like you're saying you have some of your own.
So yeah. It started because I've been having pain, ovary pain, on the right side. Well, we'll chat more about this after. But my OB was like, let's try pelvic floor. We did an ultrasound. Everything was fine.
Was this after or before baby?
After June.
Okay, so after 2 kids.
Yeah. I can't remember if I had it at all before her, but definitely since then. And amongst other things, I mean, forget it. I can't sneeze without peeing my pants. But so she's like, all right, let's try pelvic floor PT. I went a few times, but the baby was brand new. So I'm like, I can't keep going. I went a few times, and it probably would have helped had I continued going. And maybe I will revisit this now that I'm thinking about it again. But so funny. I didn't know what to expect when I went. So I go in the room, I'm talking to her, and then she's like, all right, are you comfortable, undressing from the waist down? And I'm like, why do I have to undress from the waist down? I thought this was going to be
exercise.
Just exercise. So I was like, sure, yeah. And I was not I had no idea what to expect. No one even told me. No one prepped you. No one prepped me. So, I mean, it was fine, and I was comfortable with her. So it was fine. But I'll let you.
Yeah, I try when people call. I try to look at the barriers to get people in the door, So first is addressing all of the OBGYNs, trying to explain to them, the benefits, and, how it can help their patients, and to just give a reference list of local people that are available. And I treat a lot of the local OBs, so they're obviously easier to convert, to tell their patients, but there's still a lot of people that say, they didn't hear from anybody at their 6-week checkup.
Yeah. What a shame.
And then if I do get a call, so that's one barrier, right? Not hearing about it at all. And then the other is if they get the referral, because often they'll fax it to me too, and I call them, it's hard to convert for the first visit because maybe their OB has told them, you do have to get changed. A good quality pelvic floor exam will involve the therapist using their gloved finger to assess the 3 layers of muscle in both the vaginal opening and the rectal opening, So that doesn't sound like an appealing
That part.
I get it.
That
I get
into the
it.
second part. But
Really? Gynecologist visit. Yeah.
Yeah, exactly. You do expect that from your GYN or your OBGYN, but you're not always ready for your pelvic floor therapist. But
Is that important, I guess, for you guys to assess?
it is, and there are some therapists that say, oh, they don't do an internal assessment, but then they really don't know what they're treating. It really is important, when you can look at the vast array of what's going on in the pelvic floor. You can't just base it on the symptoms. Like you could have stress incontinence because you have a very tight pelvic floor, but you could also have it because you had some tearing during delivery, and now the urethra doesn't have a secure backboard up against the pubic bone. And if you don't know that, what are you treating?
Right.
So it's important. It's not random.
Making a best guess.
Making your best guess. And too much of that already happens, in women's health. Like, I think
that is the truth.
Yeah, the more you know about your bodies, I really try to focus on empowerment and trying to make my patients independent in their care. So the more they know about what's going on, the more dedicated they're going to be to the treatment, and then the more they can do on their own at home. And to your point with the baby, it is really hard postpartum. Like I always invite people to bring their babies with them. We have rooms, they bring sound machines, whatever they want, but it doesn't always work out for the mom. It could be crying the whole time, and then it's more stressful for the mom than it is therapeutic.
Right. Yeah.
How long does the session last?
It's about an hour.
Okay.
Yeah. So especially the first eval, maybe an hour and 15, and then
which is
that.
good. So you guys take your time to really assess and
you got to there's a lot that happens, especially people that have had multiple children and, you're going through the deliveries. It's important to ask how long were they in labor? How long did they push for? Was there an episiotomy or was there a tear that occurred on its own? And sometimes it's the first time they've really
thought about these things.
Or recollected this,
Right.
I kind of thought that would happen.
Thinking back, I'm like, wait, what happened to me?
I know. I was just thinking that too. Yeah.
I thought back to my 6-week postpartum visit, and you kind of want to relive the experience with the doctor that delivered you. It's usually not your doctor, right? And I feel like that often doesn't happen. They just don't have the time built into their schedule. So I remember being prepared, like, oh, we're going to talk about this, and that just never happened. There was no talking.
Well,
about
that's what we were talking about too. The 4th trimester, it's after you have your child, and just. Okay, well, moving on, you may not even be seeing the same doctor that delivered your child. Right. It's hard to have that rapport, that deep conversation.
And ACOG is trying to do something about that. Like ACOG is the, Academy of the OBGYN. They're trying to address this 4th and recognize this 4th trimester.
Oh, that's awesome.
And increase the frequency of visits. But then it will take time for people to then implement the changes.
Right.
But it's good to know that's a conversation.
Absolutely. I feel like people sometimes they feel like all hope is lost. But honestly, I feel like there's so many positive changes. Even the fact that there's more pelvic floor therapists, more people talking about it. Rising tides rise all ships. It's only going to help everyone.
I like that.
In the end.
You probably see mostly postpartum. Yeah.
I would say it's a mix actually,
really?
because we have some universities near us. So I see a lot of pelvic floor muscle spasm, dyspareunia, painful intercourse. Their whole life never been able to put in a tampon, tolerate a speculum exam, and then they get to college and they want to have a speculum exam to maybe do whatever kind of testing they need to do, and it's unbearable, and they feel as though the pelvic floor muscles are a closed vault.
Okay.
So I get a lot of referrals for those. That's a different end of the spectrum.
Didn't even realize but that's something you could do, pelvic floor could help with.
Absolutely. The traumatic part is that people don't know, and they live with this thinking they'll never be able to have sex. They'll never be able to have children or tolerate a GYN exam to get even like STD testing, these things that are important in college,
Yeah.
So that's one part of it. And then I see a lot of pregnancy, sciatica, piriformis pain, glute pain, abdominal pain. And then the postpartum stuff that pops up, the leakage, prolapse. That's where you have tissue that ends up coming out of the vaginal opening, and people aren't always aware to look for that after they've had a baby either, but that's an issue too.
Wow.
I didn't even know that happened.
Yeah,
So does your OBGYN, I guess, diagnose that? Or
Yeah, the specialists in prolapse are really the urogynecologists, but you would have to be referred there probably from your OBGYN. So let's say you came in after having a child, you're at your 6-week visit, and you're saying, in the shower, I feel this bulge coming out of my vaginal opening. It doesn't feel right. Like I can kind of push it back in, but it pops out when I try to have a bowel movement. I feel it in the shower. Then your OB would assess, they would take a look and feel, is it coming from the top of the vaginal opening or the bottom? And they'd give you a general idea of it's, coming from the bladder or the rectum, cystocele or rectocele, or maybe even the uterus, like a uterocele coming straight down. Yeah. And then they may refer you to a urogynecologist or pelvic floor PT.
Wow.
So research shows grades 1 and 2, which means that bulge comes just to the opening, do really well with pelvic floor PT. Grades 3 and 4, which are beyond that opening, you can imagine it's kind of hanging out. They're really surgical candidates for the urogynecologist.
Gosh, what else do women have to deal with? I cannot.
Yeah.
It's wild.
I have that feeling every time I'm evaluating some postpartum, like the things we go through just to keep procreating.
Right, to give life.
It's wild.
Would you recommend to any, pregnant women right now to kind of go to a facility like yours to start, doing different things to get their body strong enough to give birth so that postpartum?
Yeah, that's a great question. So absolutely. I'm 32 weeks myself. And, as much as you'd want to, I can't treat myself. So I go to pelvic floor PT.
Okay.
Yeah.
I noticed when I got a really bad cough, that cough that was going around where everyone was coughing for 6 weeks. I'm leaking, and I'm treating patients during the day. This is not a good look to be a pelvic floor therapist leaking. It's bad for business. So I went and saw a friend of mine who's a pelvic floor PT, and it's really been great. I'm noticing a huge difference. I'm more continent when I sneeze and when I cough.
Right.
We work on alignment positions to optimize pelvic position for head down baby, perineal stretching. So you're actually stretching out the perineum to help decrease the risk of tearing.
That's awesome. You guys can do that.
Yeah, it's really helpful. And I try to teach patients to do it on their own. If you have a big growing belly and then you're in the shower, you can reach from behind. That finger can be right up against that posterior fourchette. And then you can kind of do that little circle motion to stretch it.
Yeah.
Research shows that if you do it before your first birth, it is effective in decreasing the risk.
I wish more people knew this.
Right.
Well, just another, just more information that
awesome.
isn't readily shared.
Yeah.
I think, and this is no disrespect to the medical community, but it would just be nice for, this to be talked about at initial, meetings with your OB.
And it all comes down to money, right? Like we were just talking about, the OBs aren't being paid enough, so they're spread too thin, and they don't even have the time to do all these things. It's horrible.
It's a huge problem. There's, in our area specifically, there's less and less people that are delivering. They're dropping the OB title and they're just switching to GYN because think about it. I mean, what we were talking about earlier, like the trauma with OB, things that can go wrong, the risk, the call. Like I admire, these OB/GYNs because they have such a high stakes difficult job. They're really put between these like corporate companies and their patients, and they're smushed in the middle.
Yeah.
And they get
terrible.
7 minutes a patient, and they may come in with a lot of dynamic, complex problems, So that's always my pitch too, is like, I actually have the time to sit and talk about all these physical things that are going on, and then I know I can contact you with any concerns.
Right.
But that's usually my plea for referrals. Like, do refer these patients when they need something. Like, you don't really have the time to sit and talk about stretches to do for your piriformis or what to do for your tailbone pain.
Send them to me.
Send them to me. Yeah, exactly.
Would you say everybody should go see a pelvic floor? If you're pregnant, like, would you recommend every pregnant woman?
Yeah, that's my recommendation. I don't think everyone needs a course of care, but at least check in once, somewhere between your second and third trimester.
I would have loved to have done that.
It's super helpful.
Yeah.
There's countries like France where it's 6 weeks of postpartum pelvic PT is just included for everyone.
Oh my God.
Really?
That's so cool.
Everyone. It's just part of
Their care.
The care. And their health system kind of allows for things like that a little bit more. You know, we're so divided with different health groups and, it has its advantages, of course, but them being more of a one universal system, they can implement things like that easier.
That's awesome.
But a lot of people have these benefits available in America. They just don't know it. So
Yeah, you don't know what you don't know.
you don't know what you don't know. So I try to tell people, like, you actually have coverage, you know, and when they call and they think they might have to pay out of pocket. I mean, some people do, but some people also have coverage for these services.
I would say, I mean, even if you did have to pay out of pocket and it does work for you financially, it just seems like a no-brainer.
Yeah, that it's worth it, you know, especially if it saves you down the line from having issues.
Right.
Yeah.
Yeah.
And, you know, moms, like, as soon as they have the baby, it's all about
That's it.
We were just talking about this. It's so true. You're like forgotten about.
Totally forgotten about.
I don't know. Maybe you can give your advice on this too. So we were just talking to an OB, and I know a lot of OBs are clearing postpartum patients for exercise around 3 to 4 weeks. With my first, it was 6 weeks. With my second, it was 3 to 4 weeks. And I'm like, I'm still bleeding. How is this even possible that I'm being cleared? And my sister actually is a doula and my God, personal trainer. So, and works a lot with postpartum women. And she will say, don't run until you're 16 weeks postpartum. And
Absolutely.
so I'm just curious what your take is on all of that. And
yeah, that's a big part of the population that will call for pelvic floor PT. Like, I'm cleared for exercise, and the first thing I did is go back to running, and I'm leaking. And when I think about, like, my plan to get someone back to running, there's just so many steps involved. Like, we're testing all the small muscles, we're testing the single leg squat, we're making sure they can get up from the floor without bulging. Like, there's just so many things that we're looking at that I can't imagine one person could feel like, oh, I'm just gonna go ahead
All
and
of a sudden, like, you built a human, your body completely changed, but I'm just right back.
I'm ready.
But I get it. It's like mentally you need the reprieve. You need, like, that exercise relief. But there's just, if you follow the right steps and really build your way up, you're going to have, like, a better success. And not everyone's goal has to be running. Maybe you just want to participate in a Zumba class, or you want to be able to go to yoga or what have you. So I try to tailor, you know, these programs based on what patients' goals are.
Right.
As most, I think, pelvic floor PTs do. But yeah, 16 weeks sounds much more realistic.
right.
And even as a pelvic floor PT, it took me 6 months to get back to running. Like, and I know everything about, not everything, but I know a lot about exercise and a lot about building up all the glute muscles and the pelvic floor and the core so that everything works together like a nice cube.
Right. So it's unfortunate. I'm like, why is this happening?
Yeah. They're basically saying you're medically safe. You know what I mean? Like, you're medically safe, but I think it takes the physical therapist or the pelvic floor physical therapist or occupational therapist to then assess you and see where are the impairments and the imbalances and what can we work on to get you where you want to go.
Can you explain, I guess, what the pelvic floor muscles encompass and, like, what they are?
Absolutely, yeah. So there's 3 layers to the pelvic floor muscles. I like this model here. I don't know if everyone will be able to kind of see because the red striated tissue shows you muscle. And a lot of people don't realize that there is no bone between the tailbone and the pubic bone. So everything that is holding you up from the bottom, right, is just muscle.
Wow.
Yeah. Fascia, of course, too, but there's no bony support system there. So you can see the most superficial layer here. It's almost like a figure 8 around the vaginal opening and then the rectal opening. This area is where most of the tears happen during vaginal delivery. And then as you get deeper into the first layer, it's more sphincteric support. So if you think about the order, you'll have the bladder and the urethra coming out. So the pelvic floor muscles are a big part of continence that way because they need to push that urethra up against the pubic bone when you're finished urinating. Then you have the vaginal opening where you need to be able to allow the baby to come out, but then after that, then pull back up so you're not having symptoms like prolapse, bulging, all these things. And then you have the rectal tissue in the back, which is supposed to keep you continent of feces and gas, which is also an issue sometimes postpartum. So you have to be able to relax to let stool out, and then you have to be able to contract after in order to keep things in that you don't want out. Pretty big deal, you know? It's pretty important.
Like, explaining it like that, it really, I'm wrapping my head around how intricate, and how much happens after delivery, and then
the impact on your body.
And one myth is that people only need pelvic floor therapy if they've had a vaginal delivery.
Yeah.
But for C-sections also, I mean, that's your 9 months, the weight of the baby and all these changes, maybe 30 pounds or what have you, pulling straight down on that pelvic floor. Yeah. And then, there's an incision through the front through many layers. The baby comes out, and then this pelvic floor often kind of goes into spasm.
Yeah.
So they're left with symptoms of stress incontinence too, but just for a different reason.
Yeah. I had a C-section.
Yeah.
Yeah.
There's a lot.
I thought about that too, because obviously sometimes sneezing, I'm like, oh no, is this gonna? But I'm like, but I didn't give birth vaginally. Right.
So your problem would actually be really easy to treat for pelvic floor therapists because you probably, most likely have tightness.
Yeah.
And so if you can mobilize these muscles so that they can relax, a bicep that's here can contract much better than one that's already up here.
Yeah, that makes
sense. They can relax and then they can fully contract. So it wouldn't take long for you to feel better.
Right.
So. Random question. Looking at this little model here, being that there's no bone, say someone broke their pelvis in a car accident or whatever, would they be a candidate? I mean, I can only imagine if that shifted everything, all the muscles would be
absolutely
like crazy, right?
I can think of a patient that had a bad fall and had a pelvic fracture and then needed a lot of pelvic floor PT because you have nerves that run through the pelvis, and anytime there's trauma, you can have muscles that then go into spasm and create squeezing points around those nerves, which can give you that burning neural pain. So the pudendal nerve has branches in the pelvic floor that can make it extremely uncomfortable to sit, to urinate, to have intercourse. So they would need a lot of pelvic floor PT.
Wow.
And is that something that is recommended by doctors? Are you seeing that? Or is that a missed, kind of thing too? If someone breaks their pelvis?
People have to find it often on their own. I don't know. I don't know.
Weird,
it's not, I don't think it's standard like, okay, you broke your pelvis and, now you're going to get pelvic floor PT instead of regular PT because they also need the regular PT, like they're learning to walk again after they've been sitting for so long. But the people who have found me, I feel as though they've dealt with some chronic pain and then they go on a search to try to figure out how to get better and then they find pelvic floor PT. That's my experience.
Well, that's so good to know too. I mean, hopefully no one here is going to break a pelvis, but I mean, God forbid, that's so good to know. It's not just for women or it's, not just postpartum or and you mentioned your husband also is a pelvic floor PT.
So he is not. He's like an orthopedic and sports physical therapist. So in our practice we have like multiple disciplines. Like we have acupuncture, chiropractic, physical therapy, occupational therapy.
Oh, I love that.
And so I run like the pelvic floor component and he takes care of everything else.
Yeah. Okay. I was going to say
not a pelvic floor
PT. Got it.
Yeah.
All right.
I think there are some males out there now. It used to never be a thing, but now there are a few males out there who do pelvic floor PT, but I don't personally know any.
Got it. So how would it work if the patient was a male?
Yeah, so that's a great question. I personally actually do have a good amount of male patients because not a lot of pelvic floor PTs feel comfortable treating males. And so for me, I think I originally was like, I just want to work with women. Like that's who I identify with. I feel like they need so much help. But these cases kept popping up where nobody was available to help these guys in a lot of sitting pain. So I'm like, all right, I'll give it a go. And honestly, it's pretty easy. They're usually just super restricted, tight rectums, that's giving them testicular and penile pain. And they've dealt with this for a long time. They can't find anybody to help them.
I didn't even know it could happen for a man.
Me neither.
I'm sure they're not talking about it.
Right? Correct.
Until it gets to the point where it's probably so unbearable. Right.
Unbearable.
Yeah.
But one thing I have noticed is like women will suffer, like they'll kind of say, they'll grin and bear this is part of childbirth and this. But as soon as a male has penile pain, they are on every Google search and they're trying to figure out what's going on,
I can't use my pain.
It's very important, to them. So they are motivated to get better, So do they want the rectal exam? Absolutely not. They come in that first day and they are just like absolutely dreading it. But when they realize that their symptoms are better after then stretching out all of the pelvic floor muscles, they're motivated to see through the plan of care.
Right.
Yeah.
Right. So interesting.
How is running a business with your husband?
Yeah, that has its challenges. It's like a whole nother podcast. I feel we've gotten better. It's been 5 years that we've been open. And as we've grown, we've been able to divide tasks more. And that just works a lot better than two people working
On the same
on the
thing.
same thing. You know, like I had this idea of how I want my pelvic floor program to be, and you know, my husband's not a pelvic floor therapist.
Right.
So when he puts his, you know, business minded input on it, you know, I don't really want to hear it.
Yeah. It's like you stay in your lane, I stay in my lane.
Exactly.
That
Yes.
is really, that's a common theme of other couple business owners we've heard is like, we just know who's
Our
good
lane,
at what.
yeah.
And, yeah.
Yeah. And I'd say in the past year, we've gotten better at that.
Yeah.
You know?
And you guys have a child together.
Yeah, we have a 3-year-old and then we have one on the way.
Wow,
coming
so it's
in
a lot.
March. Yeah, it's
Yeah.
a lot of moving parts.
And your girl is 3, right?
3.
And you're gonna have a boy in March. That's so exciting.
She's very excited.
Yeah, is she ready to step into that big sister role? And or does she?
Yeah, she's excited at the opportunity to have someone to boss around. And the other day she said to me, "Mom, it's going to be really hard to push that baby out." So she's a pelvic floor therapist.
I love that.
That's amazing. Actually, if she wanted to pursue that, I mean, you'd obviously encourage it.
Absolutely, yeah. I think it's an amazing profession,
Right.
You know, and I feel like not a lot of people can say that they go to work and they love what they do, and they develop relationships with patients where they feel like they want to support them
Right.
and they're invested in their care.
Yeah.
How long does care normally last for? Is it, I guess, or does it vary, obviously, based on their needs?
Yeah, I think that's a good question. It does depend on what they're coming for. Like, let's say someone came postpartum with a C-section and they had some scar immobility, or they were feeling pain even with intercourse or with orgasm, and then they also were having urinary frequency, urgency, and leakage. You know, maybe they would need like 6 to 8 sessions.
Okay, not
you know,
bad,
maybe
yeah.
twice a week, 6 to 8 sessions. This is just, you know, guesstimates.
General, yeah.
Yeah, but then people who have weakness, postpartum weakness from a tear, let's say during delivery, and they need up training to really get, you know, transverse abdominis and pelvic floor working together, they need longer. They need more time, you know, so that might look more like 10 weeks because it takes 6 weeks to see a muscle change. And then you don't really know, like, if that muscle's been reapproximated yet, you know, like when they stitch you back up, it's not always clear cut if the muscle belly is fully back together. So those are a little bit more tricky.
And is it ever, quote unquote, too late for someone? Like,
Good question. Like
2.5
years ago,
years postpartum. Is
Yeah.
it too late for me to come in? And
I would say no. There's tons of stuff you can work on when you come back in. People often have the time later,
Yeah.
you know, rather than when their baby is fresh.
Yeah.
right, like that's what I'm saying. Like how I went like 2 or 3 times, and I was like, I can't. She's only a couple weeks old. Like,
Yeah.
can I address it now?
Absolutely.
Show up at your doorstep tomorrow.
Yeah, I don't think it's too late. I think there's a lot of stuff you can do. I've seen people with some scar immobility issues like 7 years postpartum.
Wow.
You know, I don't know what the data says about that, but I still see positive changes. So
Yeah, I guess why not, right? It's your muscles, so
Yeah,
you're like working them out. So like, do you see a lot of diastasis?
yep, I see a lot of diastasis.
So that, can you explain what that is?
Yeah, absolutely. So a diastasis is not a separation, but a stretching of the rectus abdominis along the linea alba. So linea alba is a thick fascial tissue that will connect the two sides of the muscle belly together. And so as you get pregnant and become more pregnant, that tissue has to separate to make room for the baby. So
Like where your belly button is?
exactly.
Yeah.
It's a myth that only some people get it. I mean, you have to attain some form of diastasis by the 3rd trimester in order to accommodate for the growing baby. Everybody.
I definitely had that, yeah.
Yeah, it's like even when I sit up, like you might see a little coning, doming, you know, and that's just a stretch in the fascial tissue. The question is, does the tension return, you know, within a reasonable period of time? So about 66% should return within 3 months. You know, 66% of people. So if you just round it and say like 7 in 10, if you're noticing like 3-4 months that I feel like a lot of weakness, you know, vulnerability, I feel like that's a big thing people say. Then you should be evaluated by a pelvic floor PT because they can help create ways to increase the tension.
Right.
You know, and if you just go back to abdominal exercises on your own without the guide,
See, I did that.
Yeah.
Because when the doctor was like, "Oh, you'll feel better when you lose weight," and I was like, "Fuck that!" I'm like on YouTube, trying different things, but I'm like, I just need to do the crunches. I need to
Work
do
out,
what I was doing before because I used to work out, and I ended up, I don't know what I did to myself, but I had awful pain, and that's finally what brought me to a physical therapist.
Wow.
Yeah, you know, but it helped. I didn't. prolong as long as I should have stuck with it longer, or really kind of stayed on top of it. So it took a while, but after going to that, just felt like went from like a jelly, like almost like no feeling to having something holding my intestines back in
together, right? Yeah, you really are probably learning to use your transverse abdominis muscles, which go east to west, which are different than the rectus, which go north to south.
Yeah.
And so if you really can feel like you can engage, you can create a corset-like, tightness there, which will make your back feel more supported, your pelvic floor more supported.
Right.
It's all about the balance.
Yeah, it needed to be sucked back in.
Yeah, and weight really doesn't have anything to do with it.
No.
So that that wasn't really the right
I was
direction.
it's not weight. I looked pregnant.
Yeah, it's a fascial, like when you think about...
And like cone, like you said, like anytime I would like sit up in any way, I'd have this huge cone right here. Yeah. It was weird.
Yeah, it's pressure.
Yeah.
You're just seeing where the pressure's going and it'll go to the weakest point.
Even now, I work out pretty often. I try to avoid like the crunching. Like I actually picked up some really good stuff off of your Instagram to use at the gym too, to help. And,
Like exercises?
Yeah, definitely. Like your core muscles, because doing some certain things are not good if you still have diastasis. I mean, it's gotten a lot better, but
Yeah,
right,
but some
I guess,
people just push through without realizing they're doing more damage.
Sure.
Yeah.
There's two different mindsets. Like some people are super fearful, like they can't do anything, which is not right either. You know, they can do a lot of things and should be able to go back to what they wanted to do before. And then there's the other end where you're just overdoing it, you know, without really using the breath properly, knowing how to control pelvic floor because you have pressure that's imbalanced and that pressure needs to go somewhere, right? Through an exhale, versus through a diastasis or through a prolapse or leakage or something like that too.
Is that something you're doing now, you know, like any sort of abdominal exercises or breathing to kind of like keep it strong?
Yeah, I mean, you have to find the balance because you also want to allow for the tummy to expand.
Yeah.
You know, so it's like you're fighting, you know, when you're pregnant.
Supposed to do it,
You know, people think you should be doing Kegels and crunches, and really, I feel like you have to let the body expand within reason, you know? So maybe I do a little bit of like transverse ab stuff and, you know, I do some yoga, but I'm not on the floor by any means doing any crunches. Yeah, exactly. Anything like that. More isometric things, meaning like I'm not shortening too much and gentle. I feel like I'm pretty gentle with myself in pregnancy, but that's just personal preference. You know? Like
definitely.
I do love to exercise, but I'll feel more comfortable probably postpartum.
Sweet. How many people are in your practice? Is it just you and your husband, or you have other people that professionals that are coming in to help?
Yeah, we have others. So we have, we actually just recently added a sports medicine and lifestyle medicine doctor who...
What's lifestyle medicine?
Yeah, there's different pillars to lifestyle medicine where they look at even things as complex as like, oh, how bonded is this person with other people? Like, how are their relationships? How's their nutrition? You know, they're looking at all different aspects of health, more holistic.
What is that called? Lifestyle medicine?
Lifestyle medicine.
Oh, I like that.
That is very neat.
Yeah. And for our population, it's great, you know, for having people who are really struggling to get better or dealing with chronic pain to have someone to refer to in that way. We're looking for, she's only just started, so.
That's awesome.
Yeah. We'll see how that goes. We have an acupuncturist who's been great. People love to see him, Dr. Kevin. We have another occupational therapist who's a pelvic floor therapist with a dance background who teaches Pilates. So she's great for all the diastasis patients.
Yeah.
Awesome.
Another OT that specializes in hand therapy, a chiropractor.
That sounds amazing.
I know.
Two other physical therapists.
I wish we lived closer. I don't live so far, but
Yeah, we're Robbinsville, so I feel like from here it's probably 50
a little bit of a ride.
What's the name of your practice?
It's Paragon Sports Spine and Wellness.
That's awesome. That sounds like a great practice.
It really does.
Thank you. Yeah, we're trying, you know, we're a small little dot in the ocean, but like we're trying to create, you know, a holistic environment for healing.
How did you meet your husband? In the industry?
In the industry, yeah. So when I moved back home after college, you know, somewhere around 2010, I think we graduated around the same time, and then one of our first jobs was in Princeton at a similar like integrated model place. But when we first met, we didn't get along at all.
No, really?
Yeah, we're just so different, you know. I thought he was too arrogant, and he thought I was too like outgoing, and
That's so funny.
You know,
And then you realized you were in love.
I don't know how that happened. Yeah. We had to work together, you know. We're going to lunches, and I know he must have bought me lunch one time, and I was like, not too bad.
It's kind of nice.
All right.
You're pretty cool. Yeah, exactly.
Yeah.
So,
And then you guys are business partners, parents. It's so cool.
yeah, a lot of things together. Yeah, try to use our differences for for
The good. Yeah.
Fight good, not evil.
Right.
Yeah, it's been beneficial, honestly. A lot of learning along the way on both of our parts.
I mean, and that's all relationships, right? They're going to be a work in progress over time. But I give you guys so much credit to be business owners. It's scary and it's risky.
Especially in medical. I'm sure the medical world is changing and fees and all that. So that is amazing that you guys are doing it and tackling it and doing it, I think, in a thoughtful way.
Yeah.
Yeah, we're trying. We feel blessed to have the opportunity, honestly. It's also scary going to a 9-to-5 job every day and not knowing if you'll still have your job.
Totally. I would take entrepreneurship over that.
Yeah, I recommend it to people. Yeah, it's scary and it's busy, but at least you only
You have to be
yourself.
built for it.
Yeah. And you are originally from Ireland.
Yes.
When did you move to the United States?
Born in Ireland. We moved in 1992, so I was about 6 years old.
Oh,
We moved over.
Wow, so do you have memories growing up there?
Yeah,
That's so cool.
We still go back. I just took my daughter in September for my nana turning 80, and I love it there. I recommend everyone to go. People
It's on the list.
Yeah, they
That's
love
amazing.
Americans, and they'll treat you really well.
Yeah.
Did your family come here for work?
Yeah, my dad's an engineer, and we moved over to try. I think it was a new job for a year, but we ended up getting enrolled in school and
like
making friends.
30-something
Yeah.
years.
Yeah.
That's amazing.
Very
I
cool.
love that. Sweet. Well, thank you so much for coming on
Yeah,
today and
this
sharing
is
all of
great.
your knowledge. I think this is going to help a ton of
Yeah, we
women
have to
and
blast it
men.
out.
Yeah, and we're going to tag all of your accounts and everything.
You have an Instagram?
Thank you so much. Yeah, Paragon. Yep, Paragon Pelvic Health, and then we have a Paragon Sports Spine and Wellness.
Awesome. Yeah, we'll definitely link it. Sounds amazing.
Yeah, thank you so much. Thank you for having me. I
Thank
appreciate it.
you.
For sure. All right, we'll see you guys next week.